Now, Pat, 132 people within your huge organization succumbed to the virus. The courage and the heat of this was noted. What will they do? What will the MTA do to celebrate on this reopening?
Well, phase two is a big step for New York City, and frankly, a big step forward for the country. I'm glad, Tom, that you're going to be eating in New York City restaurants 5 days a week. The city needs the business and the tax revenue. Throughout the entire pandemic, the MTA employees, subways, buses, Metro North, Long Island Railroad, bridges and tunnels have been heroes, moving heroes. They've done extraordinary work in the most trying circumstances. At one point, a total of well over 10,000 employees were under home quarantine. 10,000 employees have returned to work. The number of employees on home quarantine is in the hundreds, down from thousands. And tragically, 132 of our colleagues succumbed to the virus at the MTA. Subways, buses, New York City Transit, Metro North, Long Island Railroad. And that is tragic. Obviously, New York has been the epicenter of the pandemic, but the MTA workforce has been heroes, moving heroes, first responders, and essential employees, including fellow transit workers.
What will be the process of someone on a subway, someone on a bus not wearing a mask?
Well, look, it is state law to wear a mask on public transit as a result of an executive order that Governor Cuomo issued some weeks ago. I can tell you that compliance by our employees is universal. We have done physical counts on the subways. The original count was a 92% mask compliance by our employees. We believe it is now 95%. We've got a robust communications and messaging plan to get the number even higher. And we've been distributing over the last couple of weeks millions of masks to riders who are returning to the system. It is not optional. It is mandatory in state law to wear a mask on transit. Public health officials tell us that the single most important thing anybody can do in whatever environment they're in, but including on transit, is to wear a mask. It protects you, it protects your fellow commuters, and it protects our employees.
Pat, I've been looking at pictures of workers cleaning all of the subway cars twice a day, which is fantastic for anyone who wants to ride a clean subway. It all takes money. And your CFO said that it could be as soon as early July, at which point the MTA will run out of money, will run out of the federal funding that's been propping up the finances. What then if the federal government does not re-up that financing? What happens to the MTA?
So Lisa, just one point of clarification, which is important. Our employees are not cleaning subways. They're not cleaning stations. They're disinfecting them. And we've been doing that since March 3rd. Bob Foran, our CFO's concern is well placed. We're in a dire financial situation. The MTA received $3.8 billion, was awarded $3.8 billion in the CARES Act. That money will carry us through July. We'll be drawing it down through August. The FTA at USDOT has done a good job of facilitating and expediting that money. The HEROES Act, which passed the House thanks to Speaker Pelosi and the support of the New York congressional delegation, provides an additional $3.9 billion of federal funding. It's obviously subject to Senate approval. It is absolutely critical that the MTA receive that money. We hired McKinsey to do a review of our finances and looking at the revenue decline because ridership is down across the system, expenses are up, and also a dedicated package of taxes and subsidies, which also accounts for 50% of the MTA's revenue in a normal year. McKinsey's midpoint is $7.7 billion. So the 3.8 from CARES and the 3.9 in the House bill on the HEROES will take us through 2020. It's critical that we receive that federal funding.
Pat, just real quick here, that distinction that you made between disinfecting and cleaning, why was that an important distinction to make?
Well, cleaning means taking the coffee cups out and the refuse on a subway car or bus. We've been disinfecting using disinfecting agents since March 3rd. because of the pandemic. We've also been piloting the use of ultraviolet C light on subway cars and buses. We're doing that right now. We worked with a Columbia University professor, Dr. David Brenner of the Irving Medical Center at Columbia, who's an expert on ultraviolet light. He concluded in this innovative collaboration with the MTA that ultraviolet C light kills the COVID-19 virus. We've also been piloting the use of antimicrobials, which we believe, and to be verified by independent laboratories and regulators, that it too will kill the COVID-19 virus and has the potential to do that for weeks and months after application. That would be a game changer. And the point I wanted to make to our riders is that we are looking at every step we can to minimize public health risks to our customers and to our employees. Ultraviolet light, ultraviolet C light, the antimicrobials are evidence of that.